What do you think then about them claiming that all of this is just to limit ICU capacity? Because now that's their argument, right? So it went from like protecting other people and all that stuff. Now they know that the vaccine doesn't protect others, right? It just protects yourself. It may not even protect yourself, but whatever. Now the argument that I hear from a lot of people is, oh, but the ICU capacities, right? We gotta, the less people that are vaccinated, the more people are gonna have an ICU because they're gonna get severely sick from COVID, and then that's why there's cancer patients that are not getting treatments and blah, blah, blah. So it's blaming the unvaccinated people for the large ICU capacities. Like, what's your argument against that?
Well, first of all, I don't think it's true. I don't think our hospitals are overwhelmed. In fact, what I hear from some of my colleagues in the healthcare profession that did decide not to go along with the mandates, and they got laid off, they got fired. The nurses that worked at the hospitals, they said, what actually occurred, and this is a colleague who worked in a GTA hospital, a major hospital in the GTA, and he said what actually occurred when the COVID whole thing started was that we typically had 99 capacity all the fucking time because we need money.
Right.
If there is 97% capacity, the hospital's in trouble to pay the bills.
Interesting.
So they need full capacity in order to pay for the things and basically make the same amount of money that they normally would make. Because they don't, a hospital costs a shit ton of money. It's the supplies, it's the doctors you have to pay a lot, lots of nurses, lots of staff, right? A lot of things you need to pay for, and the hospital needs full capacity in order to operate. The hospital is not going to operate well at 80% capacity because they won't have enough income coming in from the patients, because it's a whole lot of money to keep somebody in the hospital for a day or extra X amount of days, or even ICU. So then what happened was they canceled all of these, they cleared up beds for COVID patients, thinking there's going to be a huge rush of COVID because there was a huge panic, and the health ministry said, get ready because we're going to see a whole onslaught of people coming into the hospitals and just dying from COVID. And then he said none of that ever happened. So we were just no work to do.
Very interesting.
And so, they stopped these treatments. They stopped, surgeries. They canceled surgeries. They postponed them.
I know so many, I know some people who, even, now that's almost 2 years ago, but that's crazy. But in the first summer of all this, they had a surgery canceled for 8 months, I think. And it was a life-saving surgery. It was very risky that they to not have this surgery. It was heart surgery or something crazy like that. And for what? I don't know.
Well, the patient, some patients come into the ICU for COVID. Of course, this happens all the time, just like it happens for the flu and any other diseases. Happens all the time. That's what hospitals are for. And why is it my responsibility to take care of that? I don't understand. My responsibility is to stay healthy, and I am healthy, and I'm not going to be in the ICU from COVID or from the flu or any other pathogenic thing at this point. And so I don't so one argument is I don't think it's true, but another side to this is it's not my responsibility. That's the responsibility of the government to take care of, because if there's less ICU spots, then fucking make more ICU spots, hire more doctors, hire more nurses, hire more staff. Build a hospital. When the whole COVID thing started, there was so much panic that in the States, Trump brought in a whole hospital ship to New York to help them out, and they never fucking used it.
Wow.
And so, but here I haven't heard anything. We've been through this in 2 years. You're complaining about the ICU spots, and you have not increased the capacity, and you're telling me it's my fault, and I'm healthy, and I've never been in the ICU.
And then they're firing the workers. So no wonder they're short-staffed, and no wonder they're having trouble keeping up, I guess,
ICU bed,
right? When they have less help. I've seen a lot of, and I've heard from quite a few people that they've been to hospitals and they just are like, it's empty in here.
Yeah. And the emergency rooms, you get, like at Trillium, you get doctor care like this. It's easier to go to the ICU room than to go to a walk-in clinic, because there's the hospital is less filled than the walk-in clinic in some cases.
Wow.
In some nights. So you would rather go into the emergency room and tell them, oh, I need this prescription like fast, I got some infection, whatever. It's not an emergency, but you just come in because the doctor is available.